moving on. So now I want to talk about changing attitude and behavior, right? So sometimes people may have certain attitude towards a subject that they don't really like or that's not really good for them and they want to change it. How would we go about that? And that's something that goes more into actually the medical side. So we've been talking about the actual psychology, but since the MCAT is more focused on medicine, we want to kind of shift that into a more application-based kind of thing, right? So the main way to change long present attitude and behavior in a person is through something called therapy. There are many different kinds of therapy that approach the issue in different ways and focus on different aspects of behavior, of attitude, right? And they take different approaches to changing it, right? Therapy is often used to treat unhealthy or damaging attitudes like extreme phobias. One example of extreme phobia could be a crippling fear of heights that prevents somebody from even being able to climb stairs or willingly be above ground level, even indoors. So we wouldn't really use therapy to change a fear of kind of a mild fear of spiders or snakes or a mild fear of heights. If you're afraid of skydiving or roller coasters or something like that, that's normal and there's no problem with that. And you wouldn't really get therapy for that unless you really wanted to, but usually that's not the case. Therapy is usually used for extreme and damaging phobias or any other kind of attitude. For example, we'll see others. Some attitudes could be depression could be considered kind of like an attitude because it's your attitude towards yourself or to life or something like that. These can interfere with your everyday life. Like, for example, like I gave this crippling fear of heights. If you can't even climb stairs or be on the second floor of an indoor building, that might interfere with your daily life, with your school, your job, your relationships, everything like that could heavily interfere with your life. And so we try and treat that with therapy. We try and change the attitude. There's many different, like I mentioned, there's many different types of therapy, and we'll be going over each one individually. First up is the simplest, behavioral therapy. So behavioral therapy is an action-focused approach to therapy. It spends very little time focusing on the feelings, the logic, the subconscious, anything like that, your thinking, but rather it has the patient focus on actually changing the behavior. And through changing behavior, it changed attitude. This type of therapy is commonly used for phobias, anxiety, substance abuse, and OCD. Okay. Some examples of behavioral therapy are aversion therapy. And we've kind of covered similar ideas before. So aversion therapy is where the patient learns to associate the unwanted behavior with something negative. For example, if we're talking about substance abuse, through aversion therapy, we would give them maybe a small dose of their drug that they're addicted to, or there's the substance that they want to unlearn the behavior of, or unlearn or change their attitude towards. And then we would give them something negative, maybe like a shock or something else. And through that, we would try and change, and we would kind of make it associate doing that behavior that we want to get rid of with something negative, the other side effect. And through that, we would eventually, hopefully, get rid of their behavior by making them not want to do it anymore, because they would associate doing that behavior with that bad thing that's happening to them, the shock or the pain or whatever. This idea is very similar to operant conditioning, which we learned about earlier. Again, you're being conditioned to not like the behavior that you are currently doing and want to change by tying it to something that is unpleasant. As you may expect, that's very commonly used for substance abuse, or could be used for like anxiety or OCD or something like that. But mainly it's for like substance abuse or something like that. And again, notice how, because this is behavioral therapy, doesn't care about your feelings, doesn't care about any logic or anything like that. It's just focused on actually changing the behavior. It's not touching the subconscious, why you are using drugs or how you feel about the drugs or whatever else. It's just focusing on the actual action of actually using the drugs. Another example of behavioral therapy is desensitization. So you gradually get exposed to the source of fear to slowly remove it. This could be used for drugs, just in a gradual, I guess, unexposure or removal of the source of addiction, right? And it's just kind of, especially for phobias or anxiety, this is used for. If you're afraid of, say, dogs, first they'll maybe just have you write the word dog a bunch of times. Then they'll slowly start to show you pictures of dogs being happy and playful. Then they'll show you videos of dogs. Then they'll give you a toy that's a dog. Then they'll have you in the same room with a dog that's very far away. Then they'll have you closer to the dog. Then they'll have you touch the dog. And eventually, hopefully that gets rid of your fear of dogs over time, but very gradually, very slowly. Again, doesn't focus at all on how you feel or what your logical reason for disliking dogs is. Mainly, it only focuses on, we're going to get you to be comfortable around dogs, not be afraid or running away every time you see a dog. Right? Focuses on the actual action, the behavior. Next is flooding. This is another example of behavioral therapy, flooding. So it's similar to desensitization, but whereas desensitization was a gradual exposure, like I mentioned, you see a picture, then you see a video, then you stay in the same room, then you actually get to touch it, whatever. It's very gradual, it happens over time. Flooding is the exact opposite. It's very rapid exposure to a source of fear. For example, if you are afraid of, again, if you have a crippling fear of heights, they may just put you on like the 5th floor of a building straight away. And they'll just show you, look, nothing's happening. You're on the 5th floor of a building, and they'll have you stay there for a while. You'll be terrified, but you'll see that there's nothing happening, and then eventually it'll kind of like shock exposure therapy, right? But yeah, that's fine. And you don't really have to memorize these. You can if you want to. I'm just giving you examples so you get an idea of what behavioral therapy is and what the difference is between this and the other therapies that we're going to cover. You don't really have to know these. You don't really have to know what they're commonly treated for, but they may ask you, for example, they may describe aversion therapy just like I'm describing it here, and then say, what type of therapy is this a type of or subtype of? And then you'll be expected to know what behavioral therapy. Not necessarily because you remember aversion therapy is behavioral therapy, but because they expect you to be able to figure it out based on the description of aversion therapy. Okay. Similar, they may say like substance abuse. We're going to be treating a patient as substance abuse in this way, and they'll describe some type of therapy. And they'll ask you, what type of therapy is it? And you'll have to say it's behavioral, or it can be something else, right? One of the other types we're going to talk about. The next type of therapy is very similar, with a little bit extra added onto it. It's called cognitive behavioral therapy, and I think this is the most common one that you'll see on the MCAT, or the most popular one. It's similar to behavioral therapy, except now it adds in some cognitive aspects as well. So while the patient will be undergoing action-based behavioral therapy when they're with the doctor or the therapist during the sessions, they'll also is a slight focus on the underlying thought patterns associated with behavior. So they're adding in a little bit of the cognitive aspect, a little bit of the logical thinking aspect. So it doesn't focus on past traumas or events or any types of feelings, but rather focus on thought patterns you have now and how they change over the course of therapy. So for example, it might not focus on the reason behind a certain condition. So for example, this is commonly used for mood disorders like depression, bipolar, phobias and anxieties, eating disorders, insomnia. It's not looking for what got you into the phobia or the anxiety or the eating disorder or whatever else. It's not focused on what thinking got you there, but rather, what are you thinking right now, and how is that thinking going to change over the next month or 2 months that we're going to be working together? Whereas behavioral therapy is almost exclusively, I would say, done in sessions with a therapist. Cognitive behavioral therapy is done, it has the behavioral therapy aspect of being done with a therapist, but it also has another aspect where it has some cognitive thrown in in between the sessions. So I'll go here. So some examples are homework. So cognitive behavioral therapy often involves homework outside of the therapy session. So one of them, one of the most common ones, is keeping a journal to document your thoughts in between sessions, which will show the change in the cognitive aspect over time. So you show up to your session, you'll do some therapy, some behavioral therapy with the doctor, therapist. You'll write down some notes, and then when you go home before next week's session with the therapist, you'll, as you're going about your life, you'll document in a journal thoughts that you're having as you're having them. So for example, if you're trying to treat depression, if you have a sudden thought or something like that, in between one of the sessions, you'll write it down, right? And that'll show you your thought process during different events that happen in your everyday life. And that'll highlight the cognitive aspect. And then hopefully, if the therapy works, over time, you should notice that your thinking actually changes from from week 1 to week 7 or week 8. Actually changes over time, and that'll be shown through the notes. Another example is rational emotive therapy. So you learn to challenge your irrational beliefs and replace them with more rational ones. Again, if you're talking about something like a phobia, then if you have an irrational phobia, like an irrational fear of heights or something like that, where if you're afraid of even being in a building that's more than 1 story, that's kind of irrational. So you try and you do like I mentioned, the therapy where you have them in a building that has multiple stories or climbing upstairs, something like that. And you show them rationally, you're not going to fall, you're not going to die, nothing bad's going to happen to you. So you should get rid of that rational thought and replace it with this rational one where everything's fine if you're in a safe building, even if you're on the 2nd or 3rd floor, something like that. Many of the examples of behavioral therapy are also used in cognitive behavioral therapy, just with the addition of the cognitive component, okay? Yeah, and with these disorders, depression, bipolar, some of these you should know some like schizophrenia and the actual biological causes of these for the MCAT, but you don't have to know every single aspect of it because they'll usually tell you, but you should know some of them. The next therapy we want to talk about is humanistic therapy, sorry, which is a little bit different from the other 2 that we've talked about so far. So humanistic therapy actually focuses, we're moving away from behavior into more thinking now. Humanistic therapy mainly focuses on yourself and how your thoughts and views could affect the choices you make and the trajectory of your life. This therapy utilizes unconditional positive regard to focus on the positive aspects and acceptance rather than any negative aspects. So this is kind of, if you've seen maybe some kind of other therapy like intervention or something like that for people with self-esteem issues, something like that in shows or movies or in any kind of media. This is what the type of therapy that they were doing, humanistic therapy, where they're telling the people who have the trauma or the depression or whatever that it's okay, you'll get through it, and this is how your choices could affect it. It's good that you're on this path, but they don't do anything to criticize the people regardless of what they do or say. They try not to criticize it, but rather give them positive reinforcement rather than negative reinforcement, and kind of guide them. Not exactly guide them, but kind of help them guide themselves, essentially. Rather than tell you this is what you should think, rather kind of guide them. How have your actions so far affected your trajectory in life? And how could, by changing your actions just a little bit, how could that affect your life in a different way? Or how could that do something different for you, right? Like I mentioned, it's commonly used for self-esteem issues, feelings of worthlessness, trauma like PTSD. It's commonly used for veterans, or any really kind of trauma, childhood traumas or anything like that. Depression, relationship issues like trust issues, things like that. Some examples are Gestalt therapy, which it looks at unresolved issues like family trauma or relationship conflict, and it focuses on role playing with the therapist or the doctor to change how these situations affect your emotional states. This is more focused on the affective and the cognitive rather than the behavioral. Through the use of role playing with the, you will hopefully, the aim of this is to see that by role playing, you could kind of see how it could have gone differently or how it has affected your life even now. Something from very long ago has effects on your life now, and you could change it just by accepting or moving on or doing whatever. Okay. Next is another example is existential therapy. So it talks about the aspects of your life, what meaning they have, focus on how you can get more out of your life and your experiences, again, just like walking you through it and kind of talking about how your actions affect your life and what effects your actions have on other people's lives, and the kind of like the meaning you get out of everything. Okay, so again, you don't really have to memorize these subtypes theories like the Gestalt therapy or existential therapy. Just know that if they describe them, that they're aspects of humanistic therapy. And I'm just giving these examples just so you have an idea of what humanistic therapy actually looks like in real life. Okay. Next therapy we're going to be looking at is psychoanalytic therapy. So while the others were usually a couple months, psychoanalytic therapy can take years and years, and it's like a very consistent thing that you go to. It's very, very long term. This one focuses very deeply on the subconscious of cognitive, affective, and behavioral aspects. So if you've seen it in like movies, shows, media, or anything like that, the one where the person's going to a therapist for a very long time, they're talking about, so what are the subconscious like roots of all your actions, or you do this because subconsciously you have issues with your father or mother, or you do this because you have trust issues subconsciously, and that's what affects your behavior today. This is the type of therapy. It's psychoanalytic, where they analyze you. This therapy focuses on finding the unconscious causes and connections for the patient's thoughts, feelings, and actions. So this type of theory says that every action, every thought, every feeling you have, it has some kind of deep motive deep down that even you are probably not aware of that causes it or that kind of motivates it. And if we find the cause, and we can change it. But that's the only, that's like the main way. So it hopes to change these aspects, like your thoughts, feelings, actions, by finding and addressing the root cause of these issues. Again, some kind of trauma or relationship you had many years ago with your parents or a loved one, or event you had, or a fear of something that you may have had, or I don't know. It's commonly used for depression, substance abuse, eating disorders. Why do you have this eating disorder? Why do you have this substance abuse? What are you trying to like replace with these drugs? What are you trying to replace with the food or the overeating if you're binge eating? Or why are you trying to slim down so much if you're like anorexic or something? What is the reason behind it? Or for depression, what is the deep down reason for it? Okay, so this is the last type of therapy that I really want to cover. I'll be covering actually another one after this, the clicker question, but these are the main ones that are tested. The other one's not really. That one's more for just your knowledge. For psychoanalytic theory, like you may have noticed, I didn't have any examples, but because this one is actually very commonly portrayed in things like movies and media, and I think this gives you kind of like a good idea of it. And also, there's not really that many common examples of it, other than just what you commonly see. What is the root cause? Okay, going on to the next poll question. This one's a little bit more straightforward. Sorry. Okay, so the majority of people picked answer choice B, which I think is the right answer actually. So yeah, that's great that you guys got this. So first clue is the use of problem-oriented strategies. That leaves it down to some type of behavioral. So it's not humanistic, which focuses more on like your thinking and your kind of view of the world, which I would say is a combination of more cognitive with a little bit of affective, and psychoanalytical, which is more just finding the root cause. It's very talking heavy rather than problem orientated. A low number of patient-doctor sessions. So usually cognitive and cognitive behavioral and behavioral therapies, they usually have lower number of sessions because usually you can either get the problem behavior out quickly, or you don't get it out, and it doesn't matter how many sessions you do. So either it works quickly or it doesn't work at all. So there's no point in having more. Whereas something like psychoanalytic and maybe even humanistic could be ongoing, recurring. Even humanistic, it could take a while. Right. The reason we eliminated C is because humanistic is, like I mentioned, it's giving the positive reinforcement, sitting down and like, if you know those kind of like in media, if you saw the PTSD for veteran, those types of meetings where they kind of talk about how like your life after the war changed and like what your view is and how you think and all of that stuff, that's more humanistic, and you give like positive give like kind of like positive effects, especially after like some kind of trauma like PTSD or anything like that, or feelings of worthlessness, kind of change their thinking and then see how the change in thinking affects their actions, rather than using problem oriented strategies like aversion therapy or something like that, which is more like hands-on, I guess. And again, these two would also use a higher number of patient-doctor sessions, right? Because they're a lot more talking and they're more long-term. Whereas these, they're very quick, or not, I shouldn't say quick, they're more short-term. So it either works in a couple sessions, you see some kind of improvements, or it doesn't really work for that certain behavior, right? And then having a long-term thing is not really that important. And then the reason you differentiate B over A is this: the assignment of at-home exercise. The assignment of at-home exercises would eliminate choice A and stick with choice B, which I said, like something like the journal, for example. So write down your thoughts every time you have an intrusive thought or something like that. So that's why B would be the correct answer, and most of you got it. Yeah, so on a real MCAT, they most likely won't give you this type of question. This one is a little bit like more for your understanding. The way they would actually give you this type of question is they would have you, I'm gonna clear this, they would have you figure this out. Like this part, they would have you figure out. So they would give you a passage where they maybe, or in the passage, they have a paragraph describing the type of therapy that they're using. And then you would have to decide whether it uses problem-oriented strategies. You would have to decide, you would have to like find how many patient-doctor sessions it has. You would have to find if it has at-home exercise or not. You would have to find that information. And then they would just ask you simply, which of these types of therapies is the one mentioned in the passage? They would just ask you essentially like this part. And this part, you would have to figure out. All of this you would have to figure out on your own based on the passage. This one was a little bit more straightforward because I gave you all that information. But so in this sense, for this type of question at least, it comes down to a combination of actually knowing the different types of therapies and their definitions, and also extracting information from the passage, which is very important for the MCAT. And the best way to do that is just to keep practicing and doing a lot of MCAT passages. So we're almost done. The last thing I want to touch on is, like I mentioned, there's one more type of theory. It's biochemical therapy. There are other names for like biophysical, I think, therapy was another one. It's very rarely tested. It's kind of, if you see it on the MCAT, it's most likely not the right answer. But just in case, I'm telling you, and this also if you're curious as well. So this is a much more recent type of therapy. Instead of focusing on your cognitive, affective, or anything like that, on your attitude or behavior, it thinks that the only thing that affects your attitude or affects your behavior or your affect or anything else like that is purely the biological chemical. So why are you angry? Well, because you have a chemical imbalance, or you have a certain chemical state, or whatever. Why are you acting this way? Well, it's because you have this gene, or you're producing too much of this hormone, or this protein, or this whatever. Focus on the actual biology and the chemistry, instead of the actual, like, I don't know how to describe, but like the human aspect, or like the thinking aspect. Focus more on the actual biology and chemistry of behavior and attitude. So how would you fit if you think that the only reason you're angry is because there are chemicals in your brain that are telling you to be angry? The only reason you're performing these actions is because you have a gene that produces a certain protein that triggers certain hormones that have you perform an action. How would you treat that? Well, you would just give them other drugs, or give them other molecules, or you would do something else, right? Something biological or pharmaceutical to treat it. So it could be like inhibitors for enzymes, could be supplements for vitamins and stuff if you're vitamin deficient or something like that. Could be different proteins or hormones. It could be, is a very common one. Basically, it gives you like biochemical and pharmaceutical drugs to treat your psychological problems, or to give you therapy, right? And this is actually commonly used. Like, how do a lot of people treat depression? Well, you have antidepressants. How do you treat something like insomnia? You have drugs that make you go to sleep, right? Sleep-inducing drugs. It's not. Yeah, that would be exactly. Biochemical therapy would be a primary care physician or any kind of doctor giving you antidepressants, giving you sleep pills, giving you whatever else. That's the biochemical approach to therapy. Typically, it's actually a psychiatrist that usually gives these mood disorders. Sometimes PCPs can give it to you, but usually it's psychiatrists, especially for like schizophrenia and more advanced psychiatric disorders. It's usually a psychiatrist that gives out those drugs. So that's why it's like more in psychology section. But yeah, that's exactly what it is.